As of October 1st, the Center for Disease Control and Prevention has announced 2 cases of the West Nile virus in Hidalgo County, at least with 65 cases reported in Texas and at least 880 cases reported across the U.S.
According to the CDC, 605 out of the 880 cases have been reported as mild to severe, according to Associate Professor of Integrative Biology and Chemical Science, Christopher Vitek. There are over 3,500 mosquito types. He says there are at least 3 that transmit the virus within the valley. Vitek says the West Nile virus is referred to as an enzymatic transmission cycle, meaning it is transmitted from birds such as crows, blue jays, cardinals, and other birds to mosquitoes. Vitek says because the valley is a well-known migratory and bird sanctuary, the virus is a yearly occurrence.
We're probably going to see cases of it appear every single season, every single year. It's what we refer to as sort of an endemic virus. It's always going to be around.
Vitek says he believes it is important to remember and recognize that there is a possibility that the disease is circulating, even when most people do not know they have West Nile.
However, because most people are asymptomatic, that probably means that if we hear about 1 or 2 cases of West Nile virus, there's probably at least another 5 or 6 people that probably have the disease and don't even know it because they're never experiencing any symptoms. So even when we don't hear a lot about it, it's important to remember and recognize that there's the potential that this disease is circulating, and it's just we're not detecting it because of the asymptomatic nature.
Associate Professor of UTRGV School of Medicine, Director of Antibiotic Stewardship for Valley Baptist Medical Center, and infectious disease specialist Jose Campo Maldonado says humans are not the primary target since birds are the ideal host.
The virus enters to our body, we are an incidental host in the normal cycle of the virus, which is usually with birds, right?
Campos says even though it is rare, the symptoms can have long-term conditions reporting from a few weeks up to 8 years.
There are some studies that have shown very high rates of persistent symptoms, not persistent infection, but persistent symptoms after the infection.
As of now, New York State's health department mentions there is no vaccine to prevent the West Nile virus, but people are advised to use mosquito repellent that contains DEET to prevent it. For KVAQ-TV in Edinburgh, Selene Bocanegra.